I would love that we just launched with FIFA. You wash your hands. Hands is the first one.
Okay. 20 seconds, wash your hands, take the
Wash
time.
your hands like the elbow.
Sneeze or cough into the elbow.
Don't touch your face. Everyone touches their face. Don't
And
touch
then
your
the
face.
distance.
The distance.
And the feeling. Check how you're feeling.
That's right.
If you have problems, temperature, fever, and so on, then
Stay home.
stay home.
Stay home. And really,
5.
that's right. Those are the 5 things you need to do. If you have any trouble breathing, if you get sick very, very quickly, call your doctor immediately and go seek health care. But always make that phone call first so that they can expect you coming in.
Great. Thank you so much
Yeah,
for
thank
the
you.
question.
Thank you.
Thanks,
Thank
baby.
you. Very nice to see you.
I have a few more. There's a question from Amelia Surtes. Can you catch the virus from the air? Is it airborne?
The virus is not airborne.
Okay.
So the virus is spread by what we call droplet, which is basically little particles of liquid that come out of your nose and your mouth when you talk or sneeze or cough, which is why you have to do this. And those particles need to reach somebody's eyes, nose, and mouth.
That's the only way you can contract it. So guys, that is something just that you guys need to know, that please don't be afraid. There's a very specific way in which this virus can be transmitted, and it's not through air, it's not through food, it's not through animals, right?
It's not through food, it's not through animals. But the other thing I want to mention is that it could be through contact, fomites we call, which is basically when those particles get on a surface, like a hard surface like this, if you touch it and the virus is there, and then you touch your eyes or your nose or your mouth, you can get infected that way. So
if someone coughs into their hand and touches the table, and you touch the table and touch your eye, you can get it.
But that's a barrier. It doesn't mean because you touch the table you're infected. You still have to touch your eyes. So if you wash your hands, use the alcohol rub, you kill the virus. The virus is gone.
That is a great question. Another question I have from @Divya_Jyoti. If you have recovered from corona, can I get it again?
We get this question a lot. So we don't have the full picture of this virus because we're still only 12.
We're all learning.
We're all learning. But if I can mention, we know that more than 100,000 people out of those 400,000 cases have recovered. And that's also important to be part of the message. It is still scary, but people are recovering from this. And what we are expecting is for people who do get infected, that they will develop some kind of an immune response. We don't know how strong that is yet. We don't know how long that will last. So we're working with a number of countries to try to collect that data more systematically so that we can give a proper answer to that question.
That's great. Another question, is COVID-19 vulnerable to heat? And if our house is warm, will the bacteria die? Mr. Nankis asks this question.
So first of all, thanks for that question, because we do get lots of questions around temperature and what that actually means. This is a virus, so it's not a bacteria, so it's a different kind of pathogen. The virus can spread in different temperatures. We've seen it spread in cold temperatures in northern China. We've seen it spread in warmer temperature in Africa and in Singapore and in other places. There is some question about what may happen when the summertime comes in the northern hemisphere, and then the winter starts in the southern hemisphere, and it's not necessarily a change in how the virus behaves, but we behave differently in the warmer weather. You know, we spend a lot more time outdoors, indoors. So again, only 12 weeks, still trying to understand how this virus behaves, but there's, I don't know, hundreds of thousands of people that are looking at these types of questions, and we are working with as many of them across the globe as we possibly can to try to put that evidence together to help us better have an even stronger response.
Thank you so much for clarifying that. Another question which I have is there a vaccine? Finding a vaccine will be crucial to a long-term solution to corona, obviously. Are you guys working with Gavi, the Vaccine Alliance and others to produce a vaccine to ensure that everyone has access to it?
Are you starting that one?
Yes, we have started that some weeks ago, more than 8 weeks ago actually. We have convened a meeting of more than 400 scientists and there are some vaccine candidates now, and we're working on those through those scientists throughout the world. But the thing here is vaccines may not be ready between 12 months from now.
Wow,
So
it'll
it's
take a
better-
year, you think?
Yes, a year to 18 months, a year and a half. That's
Wow.
very good. You're using your elbow. So 12, so a year from 12 months to 18 months it may take.
Oh, wow.
But it's a very important investment, and we're working with Gavi, we're working with CEPI, we're working with other institutions and convening that platform in order to speed up the discovery of vaccine, but it takes time. So the idea is to do everything we can now, public health measures, to suppress and control the disease, but at the best in strategic issues like vaccines.
Got it. Wow, it'll take a year. Is it possible to have COVID-19 and not have a fever? This is asked by Jen Lilly.
It is. It would be rare though. So what we know for most people who have COVID-19 is that they have a fever, they have a dry cough, they have shortness of breath. It becomes difficult to breathe. And they may have some other symptoms like muscle pain. They may have a headache. Very few people will have a runny nose and sneeze and like you may see for the common cold or with the flu. But most people, about 90% of people in China, where we have huge case numbers, have reported fever. Yeah.
Wow. So if someone has a cold, it could also be a common flu.
It can. This is the really difficult thing about
Yeah, this is the gray area, isn't it?
Is that you don't know what you have, but there are some distinguishing features. This fever, dry cough, shortness of breath, that is COVID-19 and you need to get tested. And so the only way we can actually distinguish between each of these respiratory diseases is through testing. So it is important that that does happen, and it's important that we increase capacity across the globe.
And
Technology.
we provide tests and we find tests for people
That's
who
right.
can't get it. Another question for you, Dr. Maria. What is co-infection? Can you get two viruses together?
Yeah, co-infection means you're infected with multiple things at the same time. So some people can have influenza and COVID-19. Some people can have like a bacterial infection, like bacterial pneumonia and COVID-19. But yeah, that's what that means when you have the word co-infection.
Got it. I'm just going to take 5 more minutes of your time, just ask a few more questions because they're just interesting. What surface does the virus live on? This is asked by @MarySkelly.
So the virus itself doesn't live outside of the body unless you have a sick person that will cough or sneeze on.
How long will that last if someone sneezes or something?
So on hard surfaces, it depends on the type of surface. If it's like steel, so a lot of these studies are done in hospitals because they look at steel surfaces and plastics and things like that. So there's some early studies on this virus, on the COVID-19 virus, that suggest that the virus can last for hours on hard surfaces.
Wow.
So that's why it's important that no matter what you touch, you wash your hands and then you clean surfaces. That you're using your common disinfectants in your house. You clean doorknobs, you clean tables, and that will kill the virus.
And hand washing is more efficient than just sanitizing your hands.
So whatever you have access to. So some people have access to soap and water, and some people don't. And so if you have access to an alcohol-based rub, make sure you do that. And there's a proper way to do this for 20 seconds or 40 seconds. I should know this. Or you can wash your hands properly. Sorry. But yes, you can kill. That's the point. Is that there's a natural barrier that you have, and to wash your hands and to use that alcohol-based rub, even if you touch an infected surface, you can kill that virus.
And thank you for accepting the challenge, by the way.
I did. I have to do my 20-second. I have to find a song. I'm going to do it today. Just another question for low-income countries, because we're talking about water. Africa, India, places where people don't have access to water, soap, or even access to the education around coronavirus, what can governments or countries do so that we don't create a sort of pandemonium or a fear around, the fact that people don't have access and they don't know? What can we do to support people who don't have the access to water and soap?
This is a good question. I'll start. So we have seen really innovative ways in which people have been finding these access to hand washing stations. Where you've seen, I don't know if you've seen pictures of during Ebola outbreaks.
Yes.
You've seen jugs and you've seen chlorine with water and different things. And,
yes.
and the human spirit and human ingenuity is really creative. And we've seen through this pandemic, we've seen through other outbreaks before, that people find solutions. And we and you and others, everybody needs to do whatever they can to try to help make those solutions possible. There isn't a one size fits all. There's no one answer here. But we have to do every single thing that we can. And we're seeing some innovative ways where people are getting access to these kinds of jugs and water basins to be able to wash their hands.
That's great. One more question. How do we deal with...
Can I ask you a question?
Yes, of course.
I'm sorry if you don't mind. So my question is, I mean, we've never had this kind of interaction before, but my question is for you in terms of, you have a huge following. I don't know how many millions of people are watching you. You're a role model. And what do you think it is that you could do and your industry can do to help support this pandemic? Because we need everyone we can to help us with this, especially to reach young people.
I think one of the very important things, Dr. Maria, which is something that I'm trying to do, is make people understand that we're all in the same boat, and actually reiterate the 5 things that you said, that this is some sort of weird leveler where it doesn't matter who you are, where you come from, it's going to affect each one of us, and each one needs to be responsible and socially responsible for the other, as countries, as individuals, as people. And I think public people like me, I'm trying to do that by giving access to my fan base to you guys, and they would not have that access. So that's my way of contributing, and constantly talking about not to have a sense of panic, to be able to make sure that we think about others before we think about ourselves, stay home, because that's very important, to be able to follow the 5 rules that you do, but to constantly reiterate that to people and create a sense of less, so that panic is not going to solve the situation. People hoarding things and people keeping things for a really long time, when actually healthcare professionals might need gloves and masks and things like that. So I think it's really bringing about education around that, and which is why I'm so grateful that you guys took the time to be able to have this conversation with my fan base. I'm really glad you clarified that it's not airborne, that it's not through animals. That is something that a lot of people were creating. There was a lot of hype around that. I have one really quick question. People are saying
Look, Priyanka.
Yes.
Namaste.
Namaste. I said that a couple of days ago, Dr. Tedros. That old and gold namaste will come in handy.
Namaste, namaskar. I will tell you one secret, but you started with WEF, so I would like to end it with WEF.
Yes.
The 5 things you said.
Let's do it. The 5 things are: wash your hands for 20 seconds.
WEF
Okay.
and the F. So I'm really sorry, but we're using WEF, the World Economic Forum. The first 3 letters are actually like World Economic Forum, WEF.
So
wash your hands, use your elbow, and don't touch your face.
Face, wash, elbow, face. That's right.
Sorry, don't tell them. And then the other 2 are DF, distance. Stay at home or keep your distance, physical distance. And F, the last one, the F is, you have to watch your feeling. Are you
be aware of how you're feeling?
Aware, yes. WEF, DF.
WEF, DF.
So we started with WEF. That's where we met Priyanka.
Yes, we did, Dr. Tedros.
In Davos, So the 5 are actually WEF, DF, and I hope Dr. Schwab will not be angry at us.
We'll find out, won't we?
And
Thank you so much for taking the time.
I have another request. She told you that you have a big following, millions.
Yes.
And I hope you will tag me and get some of your following and transfer them to me.
Guys, you heard that. Let's follow the WHO. Let's donate to the WHO. They need our funding more than they have ever needed. These are the people on the front lines, Dr. Maria, Dr. Tedros. I can't thank you enough for taking the time and answering these questions for, people like me who are ignorant of everything that you know, but WEFDF, we will remember this, and thank you, and I hope that we pass through this faster, we flatten the curve faster, and everyone is responsible, and I hope that it doesn't take extremely long for us to be able to get through the coronavirus. So, one last question, what does the WHO need from us?
We need 2 things. 1, I know people are worried. I know people are concerned, and they're right to be concerned and worried. Maria had said it already. But what we say is we need strength, unity, courage, and we need to fight like hell to kick Corona out. We have the means to do it.
Yes.
So we should really believe in ourselves. The human spirit is very, very strong. And when united especially, we can achieve what we want. That's kicking the virus out. So, of course, we should be worried. Of course, we should be concerned. But we need courage, strength, and fight it out. And we should not be, lose hope. We have all the means to kick this virus out. So that's our message. And the second request is we have the Solidarity Fund. Mm-hmm. And Global Citizen Hugh Evans is helping. This is something we started with UN Foundation and the Swiss Philanthropy Organization. And in just 1 week, we were able to mobilize more than $70 million. This is big. Wow. In just 1 week. And we would still ask, all your funds and others to contribute to the fund, because it's the solidarity that can help us to kick this virus
Well, you heard Dr. Tedros, guys, the Solidarity Fund, we've already donated. Global Citizen is taking a big part in it. And it'll just take so much from you guys. Just listen to what Dr. Tedros said and Dr. Maria said is WEF.
DF.
WEF,
F5.
We got it. The Solidarity Fund, and thank you so much, and thank you for doing the work that you're doing. Thank you to everyone out there who are on the front lines doing this for us, and let's do what we can do, you guys. Let's make sure we stay home, be aware of ourselves, practice what we need to do in terms of sanitizing, in terms of hand washing, and keeping a little bit of physical distance from people. I can't tell you how grateful I am to both of you for taking this time, and to all of you, almost 45,000 people who are watching this live. Thank you so much. And a namaste.
Thank you. Namaste. Yes. The fight is everybody's business. That's exactly what you said, and I fully agree. We fully agree.
Thank you so much. Thank you, guys. Thank you, everyone. Thank you. Bye.
Thank you. Bye-bye. Namaste.
Namaste.